Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and I just am so excited to share with you some of the technology I've now incorporated into the office. This laser is so amazing. So it allows me to do a myriad of procedures here in the office that I was never able to do before. So the laser is, it's called the Lightwalker, and it uses photon energy to clean and sterilize. We can cut bone, we can cut hard tissue like teeth, we can vaporize nerves, which is a procedure I'll get into called sweeps or pips, where instead of doing a root canal, we can actually clean out the tooth using laser energy with none of the conventional modalities that go along with it. We can do drilling without any numbing. We can do frenectomies, tongue tie releases. We can do crown lengthening, which is where we raise the gum line up so that if you have short teeth or a tooth broke off or cavity went below to the bone, we can actually go ahead and clean that out using photon energy instead of using a scalpel and burrs and all these other things. It's really amazing. So this one's called an Erbium ND laser. So it has two functions. There's one wand that allows me to do anything soft tissue related. It's drawn to the moisture and the color of the tissue. So if I had something that just went below the gum line, I'd painlessly use this little wand to vaporize the little gum tissue so I'd get a clearer view of the tooth. But the one I'm most excited about is this one. My ND laser has the photon energy. It also has water that goes along with it. Most lasers, any doctor that talks about laser dentistry or laser anything is using this type of laser. We have a couple of those other ones in the office, but these can only cut soft tissue. They can't cut bone. This laser is drawn towards hydroxyapatite or water in the bone or in the hard tissue. So I have a couple little hand pieces I'm going to talk about. Bunch of different tips that I'll use, and it's seriously just the most amazing thing in terms of the fact that with very minimal or no anesthetic, I can use this handpiece just like I would a drill and go ahead and use this photon energy, which is sometimes more than 50 pulses per second, to vaporize the tissue. This area will light up. We all have to wear safety goggles. The only disadvantage is it's a little loud. It sounds like 1,000 rubber bands snapping at once. But this little tip will actually go in just like a periodontal probe would, and this will allow me to get alongside the tooth so that if I had an area that went like this, decay below down to the bone, I could either use this tip, or both to start to remove the gum tissue out of the way. Then I can actually slide it down alongside where the bone is that I need to remove, and it'll pulse and actually just vaporize this one area so I can actually get access and a clean margin to the decay that's below the bone. And because we're using photon energy to cut, you don't have a lot of pain. I can also use this feature to get hemostasis, which means I can control all the bleeding. So you leave not in pain, without bleeding, and you just had a surgery. I just think that is so phenomenally cool. Now the way we can use it, I have two different tips I can use for removing a cavity also. And again, without numbing. These tips work. There's a tipless one also for removing cavities. And it actually has an ability, there's several mirrors in here that direct the photon energy, that if I converge on the tooth, if I hold it far away, it actually sends a pulse frequency that tells your nerves not to be bothered by what I'm doing. And that's what allows me not to have to numb, is that a drill uses water, which being close to the nerve can be sensitive, but it also is using a lot of friction and it's air driven. So the vibration of the drill, for people that hate the dentist, that's a lot of times what bothers them, is they're like, I hate the dentist, I always feel it. Sometimes they're actually feeling so much of the vibration, and that's what has their tooth stay sensitive after, is their tooth has to recover from the heat and the friction of the drilling. And with the photon energy, that just doesn't happen. So I can hold it above the tooth, and converge on the area of decay. And I can switch the settings to hard tissue. I can switch the setting to soft tissue. I can switch all the water frequencies. I can switch it onto the anesthetic mode, which is that pre-numbing mode, which also works for the soft tissue surgery also. And on this one, I can pre-select if I'm going to remove enamel. I have cavity that goes deep. I have a cavity that goes into bone. I can choose from my menu how it's going to pulse. So in this case, if the cavity goes really deep and close to the nerve, which is in the center of the tooth, I would choose the appropriate settings and converge in on it. And the best part is that if it does encroach on the nerve, every single dentist that does not have this laser, if the cavity goes into the nerve on an adult tooth, we're trained and told that the tooth, it's done. We have to, no matter what, do a root canal after the procedure because we've essentially now traumatized the nerve enough that it's going to die. So I have a bunch of different settings where I can choose now that, oh wow, look at that. I've gotten into the nerve. This is really, really deep and close. So what I'm going to do now is switch my setting. Using photon energy, I can sterilize the nerve where it's exposed, and I can also tell it not to bleed and not to be traumatized, which essentially those processes are what would cause the death of the nerve. It says, I'm bleeding, I can't heal, and then essentially the nerve tissue will die off, and then you'll either be in pain or you'll end up with an abscess. Using these settings, I can actually sterilize the area, tell the nerve not to hurt, which isn't a guarantee that it never will, but at least it's a great step in the right direction. So far, I haven't had one that did hurt. To sterilize the nerve, and now I can just go ahead and put my filling in. So instead of doing something like a crown, a buildup, a root canal, you're actually potentially saving yourself thousands of dollars, in addition to saving yourself a lot of tooth trauma, potential infection, and pain by going in with the laser instead of just the drill to clean out these deep areas of decay. This is also phenomenal for treating areas with root decay because I have all these settings and modes where, again, with root decay, when it's deep and along the gum line, they're extremely difficult to treat because when we go in with our drill, we cause a lot of bleeding from the gums if it goes below the gums, and you do not want blood or salivary fluid to mix with a white filling or any white crown. Anything that requires bonding will get contaminated, and it'll either cause a really bad infection, it'll cause the filling not to stick, or the filling will turn black from the blood and bacteria leaking into it over time. Now, I don't know about you, but even a scientist or a non-doctor would say that's no bueno. So this allows me to say, oh, wow, this is getting really deep. And again, like I mentioned earlier, I can vaporize the tissue out of the way. I might say, now I need to remove a little bone. Now I can say, I'm going to laser out the decay. I can laser the decay, and then I can actually, with a clean, isolated, no bleeding environment, do a perfect conservative filling, and the gum tissue will heal right over it. And I'm going to show you some pictures of some areas where I've treated that are really impressive. So thank you for listening to me and my enthusiasm and excitement about this phenomenal machine. And I hope to see you in our office to talk to you more about our laser.